Hello! Surgery day is tomorrow morning. I just wanted to make a quick video to talk about the surgery itself, risks, recovery, stuff like that. A couple things I didn't mention in my last video, and just a little check-in. So, surgery's tomorrow morning. I have to be there at 7:15. I'm having a sleepover at my mom's house because she's taking me for surgery tomorrow. I don't really feel nervous right now, but I feel like I will feel very nervous when I get there. But I trust my surgeon and I know I'm in good hands. So I just want to, first of all, I just want to clarify about the surgery because I was wrong in my last video. They will drill through the bone, but then it is hollow back there where they put in the little wires, but then the actual implant will just sit under my skin. So that won't sit under the bone. So I just wanted to clarify that. And then there are a couple of risks to the surgery. You got to be careful. There's a lot going on in your inner ear that affects your body. You could have facial paralysis, but the risk is very low. And my surgeon said she's done hundreds of surgeries and she's never seen it. So I'm not worried. And she said you could have a metallic-y taste in your mouth after. But that's really it. You do have to be careful in there. There's a lot going on, but it's not super high risk. As far as recovery, she said it's not terrible. I could possibly have some dizziness or balance issues. She said she hasn't seen anything too crazy. That was my worst fear, to be off balance. So hopefully that's fine. And if I do have anything like that, it won't last too long. What else? That's really it as far as, recovery time. Obviously it's not taking me down physically too much, so should be fine. And then I will have a follow-up appointment with the surgeon on the 29th. And she said after that, I pretty much am cleared to go back to normal activities. You just can't fly for 6 weeks, and I have a trip in 7 weeks, so I did make sure before I booked my surgery. That's fine. And then you can't swim for 2 weeks, and then you just have to be careful getting it wet and stuff until the incision heals. And then the good thing is they should never have to go back in once the implant is in there. They never have to go unless there's an issue, but that's not common. So the outside piece, the processor, those do update every 5 years or so. They just came out with one, I think, less than a year ago, which is awesome. So that's the one I will have. And then every so often the technology, which is great because they just keep getting better and smaller. So it's awesome. So that's really great. And I was just glad to hear that there's never another surgical procedure. So there's a variety of colors that you can get with the outside piece. Because some people like to match their hair color. I decided to go with white because I actually wasn't really sure what color I was going to go with at first, but I didn't love the brown color. So I have been following this woman on Instagram who has 2 bilateral, and she just got a new one and she decided to go with white, and she said that she wanted people to see it. And I agree with her. I'm not trying to hide it. I want people to see it, and maybe it helps them understand that I do have a hearing issue. And when I have my hair up, no matter what color I have, you're going to see it. So I'd rather you just get a good look at it. And it is what it is. If people want to ask me about it, I'm totally comfortable with it. I want people to know about it, ask me questions if they want, but not something I'm trying to hide. But anyway, I just like the white, and so I chose it. And apparently you can also get fun skins to put on it and be super festive. And I love a good theme, so you never know. So also, my activation day, which I keep forgetting to mention, is not until February 25th. So that won't have the outside piece on until then. That's activation day is when you put it on, obviously, for the first time, hear what it's going to sound like. Then the audiologist, it's to her computer, and she can kind of out fits my hearing needs and how the sound comes in and the levels and stuff. Also, once I see the audiologist a couple times when I initially get it on, then I don't even really have to go into the office for appointments because she can adjust it remote from her computer, which is super awesome. But also, I feel like I'm gonna be more deaf because the implant kind of cuts off the hearing that you do have, which I mentioned, but my surgeon did say she, does the best to salvage what you have. But I was like, wait, so it's gonna be a whole month or I could be worse? So anyway, I told my family mentally prepare yourself because it could be worse. That's about it. Honestly, I don't really know how I'm feeling right now. I've been so busy that I just haven't really had a moment to like feel super nervous. But right now I'm feeling good. Tomorrow goes, and my mom is taking me. She's a nurse, so I'd be there anyway. But I just feel that comfort with her there because she just always knows what's going on, especially when you can't hear. And I also just wanted to say thank you to everyone for all your support on my last video, and it means the world to me. I feel like I could conquer anything with all of you on my side, so I'm just super grateful for that, and I'm gonna keep sharing my story, and I hope to educate people and help anyone that might be going through the same thing or know someone that might be suffering from hearing loss as well. So I think that's it. And I will update you guys tomorrow when I'm out of surgery. Thanks for watching. Also, hold on. My mouth is dry.